Hello and welcome to GPAC Community Outreach. We are public access television, channel 23 on local cable. You can find us on social media by searching GPAC TV 23. And you can also visit our website at gpactv23.org. My name is Tanisha Woods and my co-host is Daryl Tedderton. Today we have with us Reverend Dr. Arlisha Simmons, the East Regional Associate Director of Partners in Health and Wholeness, which is an initiative of the North Carolina Council of Churches. The council turns 90 years old this year and has long been at the forefront of integrating faith, health, and justice in communities across North Carolina. Dr. Simmons is here to share how they are doing just that with an upcoming day-long event entitled the Greenville Faith and Mental Health Summit that will be hosted on Thursday, April 3rd. Dr. Simmons, welcome to GPAC Community Outreach. It's great to have you here.
Thank you so much for allowing me to spend this time with you.
Wonderful. And so we're looking forward to all of the information that you have to share with us today. And to get us started, can you share with our audience who you are and your connection with the Greenville Faith and Mental Health Summit?
Well, as you stated, I am a staffer here at the North Carolina Council of Churches. We are based in Raleigh, North Carolina. Because I serve the eastern part of the state, I am based in Fayetteville, North Carolina. However, we are not new to working in Greenville. And so I'm a native of South Carolina. However, I've lived in North Carolina a number of times for a variety of reasons. I first came to North Carolina in 1996 and started off my professional career as a journalist in Eden, North Carolina. And then I returned in 2001 and taught at UNC Charlotte. Then I returned again in 2009 and started as a student at Duke Divinity School. And I am back in the state serving the churches throughout the state of North Carolina, helping with things related to health and justice. And so I'm excited to be back in the state and to serve God's people.
And thank you for that, Doctor. What was the inspiration, if you don't mind me asking, for creating the summit, and how did it get started?
Well, the summit is not a new invention. And as you said, the council is 90 years old, and we have been in the state working across denominational lines, working even across racial lines when it first started with Black and white clergy working together. So as part of Partners in Health and Wholeness, our initiative that is turning 16 years old this year, we've had a number of summits throughout the state. However, with our new programming, with what we now call the Abundant Life Initiative, instead of having one large summit, our summits had previously been held biannually. We held our last in 2022. And because we did not have one in 2024, we thought we would make this year big. And so we had 3 across the state. We had our first in Asheville in February. In March, we had one in Sanford. And so our final summit for the spring will be in Greenville. And because we work with people all over the state, it's an opportunity for faith leaders and members of congregations. And earlier I said churches. However, we have people who are part of mosque across the state who work with us. It's a time for people to come together and sit at the table and have breakfast together, have lunch together, sit in workshops and talk about what is happening in their faith communities. So it's a very interactive experience. And so, as I said in Sanford, this is an opportunity for us to get out of our silos. I'm an ordained Baptist minister. And I'm what you would call a cradle Baptist. But I know that sometimes we stick to what we know and we stick to our silos and we only know Baptist. Or if you're Methodist, you only know Methodist. When we come together, you don't know who you might be sitting with. Your church might be the largest church in the city, and you might be sitting next to someone who leads a church that might be considered a storefront church. However, you have the same mission, the goal, desire to serve God and serve God's people. And so when we get to these summits, it's about education, about empowerment, and bringing God's people together so that they can be strengthened to love and serve the world.
Yeah, I appreciate you sharing that with us. Are there any other goals and objectives that you can share regarding the summit?
With our summit, as I said, it is a part of our new initiative called the Abundant Life Initiative. We have received funding from North Carolina Department of Health and Human Services, as well as the Duke Endowment. And so we are trying to develop an awareness of mental health, reducing stigma associated with mental health challenges, and just increasing mental health literacy. So when you attend our summits, you are going to leave not just with, oh, that was nice. Sometimes we go to workshops and conferences. We say, oh, that was a good time. Well, we want you to leave maybe stirred up to say, you know what she said, I'm going to go and research it, or our church needs that program, or maybe we should add that to what it is that we're doing to serve the community. So it's really about literacy. So, so often in our congregations, if someone comes to the altar, or as a pastor, I've been a pastor, someone comes to our office and they tell us of a concern, sometimes we're only equipped to pray about it. But what people need oftentimes is, what's the next step? And because we believe that God can heal through a variety of modalities, we believe that through the modality of education, we can help that pastor, we can help that faith leader. So when someone comes to you and they're experiencing a mental health challenge, you can pray for them, or you can direct them to the right resource. And by coming into our summit, coming into our webinars, we hope that you will begin to develop a list of resources in your local community so that you can address some of the issues that sometimes we're not equipped to address, because sometimes we're not trained in our theological education to address some of these things, which require just a different level of skills and a different knowledge set that we may not have in our pastoral care training.
Yeah, so we can hear that education, literacy into action. So appreciating you sharing that.
Yes, that's very good information. Also, Dr. Simmons, I was wondering, how would a faith community leader be able to identify someone that may be dealing with mental health? How can they identify it, and how could they support them in any way?
Mm-hmm. Well, that's not a quick question to answer. It really will depend on one's training and one's exposure. So as a student leaving Duke Divinity School, my ordination process required that I do clinical pastoral education. And I did what is called CPE at the Veterans Administration in Durham. Okay, so the VA that's right across the street from the Duke University Hospital. So through that training, I got a lot of, one-on-one interaction with people experiencing some mental health challenges. That did not make me or give me enough training to diagnose. I cannot diagnose, but because of that 400 hours of training, when I walk into a grocery store, I walk into a store, even in the church, I have some sensibility like, this might need some attention in this area. So it's through training. It's through knowledge and information, especially programs that we promote like mental health first aid. And it's one of those things, how you have traditional first aid. So you are able to revive someone who may be having some type of, let's say, heart distress. With mental health first aid, you are able to respond. And so it's not about you, because if you're not credentialed or licensed or properly trained, we do not do diagnosis, but we can say, okay, this is beyond just this person may need some assistance. And so who do I call, or who do I direct them to? And that can happen when you are at the altar praying for someone, or it can happen as you are going about your regular day. And I've used my mental health first aid training a number of times to intervene, and meaning to intervene, before someone calls the police. It's about, let's assess what the situation is. And in some cases, someone might just need a spiritual companion to be there to listen, to help diffuse a situation. So that's the best way I can answer that. And not everyone is comfortable doing that. They may automatically call 911. And in some cases, it is appropriate to call 911. But we want to make sure that people are equipped so that no matter what instance you have, you at least know, okay, what should I do? And then you know what to do.
Yeah, being equipped, having the resources, being able to connect them, absolutely. So we see that we've stated that the event will be held on April 3rd. Can you speak a bit about what the event will include?
Yes, I will definitely do that. And so, what are summits? And as I said, we've had 3 summits and they have all looked completely different. We will have a similar format that we used in Sanford, where we start with a time of centering and introduction, and then we will start with our plenary speaker. So, the plenary speaker for our Greenville summit is Dr. Elizabeth Heath, Elaine Heath. And so Dr. Elaine Heath, I did not know her, but she was once the dean of Duke Divinity School. But I came to be familiar with her work. She has a book called, she co-wrote called, Trauma Informed Evangelism, and she does work in pastoral care. And so I went to an actual session that she sponsored, similar to our day-long session, where she taught clergy members as well as, community members about what does it look like for a congregation to become trauma informed and trauma responsive. And so based on her teaching and just her ability to be transparent with those who were gathered, I realized she would really be a good speaker. And she's also a renowned figure in this area of trauma informed care in congregations. And so people know her across the country for the work that she does. So she'll come in, she'll be our plenary speaker, starting us off first thing in the morning. We've embedded some breaks into the time so that people can talk and interact with one another. And then we will go into lunch. And so lunch is going to, I believe it's going to be great. We have, enlisted a local restaurant, G&K, and they will cater our lunch. And then we'll have breakout sessions. And in our breakout sessions, it's an opportunity for you to be in a smaller group. And so Dr. Heath will do one of the breakout sessions, and that will be called Trauma-Informed Teaching and Preaching. And so when we talked about trauma-informed teaching and preaching, some people have been trained in how to teach, or you've taken a homiletics course, or you may have been trained as to teach Bible study, or you may have just been given a book and you do it every Sunday with the help of the good Lord, as my grandmother would say. But we hope that in this session, you will get to examine the ways in which you present information to the congregations and the faith communities that you are in. Sometimes we don't realize that some of the things that we say, and possibly some of the things that we might do, might trigger people who may be experiencing trauma or have experienced past trauma. And we don't necessarily are fully equipped to understand that. Have you ever tried to touch someone's hand and they kind of jump back and you're not sure what's going on there? Yeah. It's likely that they've experienced some type of trauma. We don't know. And in some instances, they may share it with us. And they may say, when you touch me like that, it reminds me of. That's not always the case. And so sometimes people will hear things in our teaching and our preaching, and we may never get the note that they have been triggered. And so in her breakout, that is what she will cover. Our next breakout, and it's part of our ongoing programming with Partners in Health and Wholeness, is faith communities responding to the opioid crisis. We have previously hosted a number of workshops in the Greenville area, and we have churches that we've previously partnered with doing the work for harm reduction. And so our presenters will be one of my colleagues here at Partners in Health and Wholeness, Donna Parks Hill, and Jacob Harding, who is a student at ECU, and he shares his experience of navigating substance use. And so I'm excited about that dialogue and that conversation. And I believe we're also going to add in another figure who works with an organization throughout the Eastern region to talk about the impact of harm reduction on those in our congregation as well as in our communities. The last breakout we'll have will be presented by Melissa Radcliffe, and it's about recognizing, supporting, and advocating for children of incarcerated and returning parents. And, sometimes we talk about incarceration and the impact it has on our community as it relates to maybe the men in our African American community. But sometimes we fail to remember the children, and sometimes it may be not only a short-term impact, but it may be long-term impact. So one of the things that we do in our work is we help people to understand ACEs, or adverse childhood experiences, and the impact that can have on people, not only while you're in childhood, but for the remainder of your life. And there's data and statistics to show that depending on how many adverse issues you've had through the course of your childhood, that could impact you. Of course, we know that we're not statistics. We don't live and breathe as statistics, because, some of us have overcome some of the ACEs or the boxes we've checked, but we'll talk about that and the mental impact it has on our children in society.
So in the workshops that you've named, will participants be able to choose whichever one is of interest to them?
Yes, people will be able to choose which is of interest. And what we find sometimes is we advertise what we're hosting, and people will come, and after the presentation, the keynote, or even after interacting with their table mates, they may choose to do another one, or they'll say, I have enough information in that area. Let me go and see what this person is talking about. And so hopefully, as you attend the breakout sessions, you might say, I'd like to bring that information back to my congregation, and maybe we can expand the conversation, or we can add another speaker, or we can bring in another perspective. And so, of course, as it relates to these topics, of course, they're not, the speakers and the information is not exhaustive. There's more information, and there are other experiences that can be shared. And so hopefully, after getting the information, then you can tap into the resources in your local community.
Wonderful.
Dr. Simmons, with that, all the information you shared about the children maybe experiencing different things in their life growing up, a question comes up for me is, who should attend the Faith and Mental Health Summit? Like, is it just for doctors? Is it just for pastors, bishops? Are children able to attend, being that they also experience different things in their life?
Well, this event is not packaged or curated for children to attend. So I would definitely encourage anyone 18 and older to attend. And because of the content of what it is we will be sharing, we don't have specific programming related for children. And so I think if you are a pastor, a leader in a congregation, a deacon, someone who is a part of the health ministry, someone who is in the nursing ministry. Recently in my church, we held a mental health first aid. And so I invited those who are first responders, or what I call first touch. Those individuals, as someone walks into your property, coming to your church, not the visual, not the virtual church, but physically coming to your faith community, who would be the first person to touch them? So is that the person in the parking lot? Because they are the first person to have an interaction. Is it the usher? Is it the greeter? Is it the hospitality minister? So those who are first touch ministers, and even though we don't name them ministers, if you are an usher, you are likely the first interaction an individual has in many of our congregations. And so, and then there are people from the community. They may not be a part of a faith community, but they have an interest and a vested interest in mental health. As we know, things are shifting economically, politically, and people are in a state of flux, whether you go to the grocery store and you can, sense that there is anxiety. I think we're all equipped. So this information isn't just for you to take back to your congregation. You may have to use this information in your workplace. And so, as I said, it would be for the 18 and older audience because of the nature and the information that will be shared. However, you will leave knowing how to better care for the young people in your congregation.
Appreciating that information. So if, our viewers are sitting there, they're like, okay, I'm 18 years of older. I see April 3rd. I'm available on my calendar. And I've fulfill one of the roles that you just named, can you just speak to and remind us, you may have already stated a few things, but why should someone attend the summit? Like, okay, I fulfill that role. I see
Mhm.
that I am, an adult and could perhaps benefit, but what's a word that you can speak to them as to why they should go ahead and be in alignment to attend on the 3rd?
Because you want to be knowledgeable, you want to be equipped. And let's say I think in all of our well, I can't say that, I shouldn't say that. I know in my family, there are people who are experiencing mental health challenges. And I believe as we are navigating this human experience, whether we ourselves experience mental health challenges, we all have mental health. It's a part of our holistic health. And so to gain more knowledge of how to interact with one another, to help people, as well as to reduce harm. When I say reduce harm, reducing harm could be, the next time someone just automatically wants to call the police because they feel like there's something that's out of control. Maybe you are that person who is equipped because you've had some level of training, whether through an internship or whether through mental health first aid. You can say, let me just talk with them for a minute. And within a few seconds, you can diffuse a situation that could possibly end up tragically. And we've seen that too many times where authorities are called for mental health crises and it does not end the way anyone expected. And so I think if you are in this world, especially if you are a person of faith and you want to partner and walk alongside, as we say in the church, our brothers and our sisters, we are our brothers and sisters keeper, then I would want to be better equipped to love and to care for those who are walking alongside me.
Thank you for that, Dr. Simmons. Also, I have a question. What steps should viewers take to register for the event?
Well, a number of ways you can register. You can go to our website. And so the website information, there are 2 websites. If you're listening to this and you're not seeing it, healthandwholeness.org. So health, the word and wholeness.org. Click on events and scroll down and look for the image of April the 3rd. You can also call our office, and that number isn't on the screen, but I'll give it to you if you're listening. It's 919-828-6501. That's 919-828-6501. Or you can call me directly at 984-999-8839. That's 984-999-8839. It's a quick registration process. If you are listening today and you believe that maybe a group of you from your congregation or your seniors group would like to come, just call our office, call me, and we can get you registered manually or direct you to the online page. But it's a simple process. There's a small fee. However, we do have scholarship support. And so we just invite you, if you just have just a general interest, or that you want to know a little bit more about mental health and mental wellness, then we invite you to join us.
Thank you for that information. Also, I want to ask, they're getting excited, they're ready to come to get the information. What do they need to bring? Is there anything that the attendees need to bring to the summit?
Just bring an open mind. And so there's no educational requirement. Of course, there's the age requirement just because of the information that will be shared and the ability to be able to navigate the information. But bring an open mind. We will provide you a pen, something to write with. We'll have something for you to drink, something to snack on. Be willing to just hear the information, to meet new people, and to see how God is working in us, through us, and even in our neighbors that we may have never, talked to before. And so that's the only thing I would definitely consider that is required for the day.
And is there a cutoff or a time frame as to registration ending?
In a perfect world, we would like for you to be registered by this Friday at 5 p.m. And so if you hear this interview, it's Wednesday. If you hear this interview and you decide on Monday that you want to come, we invite you to just call us as soon as possible so that we can make sure that we can properly host you when you arrive. But if you could call us as soon as possible, we want to make sure that we have everything. We're equipped to host you and to do that. And yes, so Friday at the absolute latest, if you could call us by Friday at 5:00.
Wonderful. So we have the call to action. We have the steps, or we've given the steps as to what our viewers, our listeners need to do to register. And if you can just remind us one more time, they're going to sign up. They're going to be prepared to come. What would you like after the full day of April 3rd has finished? The event is wrapped up. What do you want participants to be able to walk away with after having attended the summit?
Well, we are currently working with about 40 churches across the state. So individuals from those congregations will come. And so we are working alongside of them to build programming within their church. But if you are not a part of one of those groups who are in what we call the Abundant Life cohort, we want you to leave out with questions, possibly. Sometimes people think, well, they didn't answer all my questions. Sometimes in an hour and a half, because of the complexity of the discussion, of course, Dr. Heath can't answer all of your questions, but we want to give you a toolkit so that as you come, you can say, I've seen that, or I've heard of that. Let me find out more information. So we want you to continue your inquiry. We also want you to go back, if you are a lay member, and go back to your pastor who may not have attended and say, Pastor, I was at this workshop and they talked about ABC. Is it possible that we could bring someone in who could talk to our entire congregation about ABC? Or you can say, Pastor, they talked about this study guide. We have an Abundant Life study guide. And if you go to our website, you can actually download a copy of that. Myself and my coworker last summer, we prayed and just thought through it of how do we begin helping people talk about mental health and wellness in their congregation. It's a 4-unit study guide. It's free. It's absolutely free. If for some reason you're unable to download it, you can call our office. We'll mail you a copy. But we want you to come and to call someone on the phone and say, guess what I learned? And to seek further inquiry. And so we are excited that when we host these types of programs, people call us back because they want to know the names of our speakers, or maybe someone mentioned a book and they want to include that book as a study in their church's time of study or time of discernment. And so there are a number of ways in which we call people to action. And even because of the organization, we call people to action as it relates to even possibly calling those who represent us in the state as it relates to any bills that may be coming up that deal with health and wellness in the state. And so we activate you to be more mindful of if there are going to be any changes to Medicaid, or if there are going to be any changes to access to care, that you can say, this is very important, because while it may not impact me, it may impact someone in my community. And so hopefully you discern while you're there the ways in which God is calling you to respond. But hopefully you will leave stirred up and with some type of inquiry so that you can determine, this is only the first step. There are some things I can do to continue the work that we've started today.
So, Dr. Simmons, I know they're going to leave with a lot because you sound excited. You sound ready. All the information you've given us so far is great. But is there anything that we haven't asked, any questions or any information that you would like to give to the audience that we may haven't touched on today?
Well, as I said, if you are unable to make it to our summit, this will not be the last program that we will do in the state. We will have some more summits in the fall, but we hope that you could join us for this one. We do have a webinar that is coming up, and if you go to our website, you'll find it. It talks, and the topic is healthy aging and mental well-being. We will have a representative from the dementia Alliance of North Carolina to be with us. And so our goal is just to strengthen faith community so that you can continue to do your work. And so we look forward to your audience members joining us at St. James United Methodist Church. We hope that by the end of someone listening or viewing this interview, we have a packed house and have to turn people away, or we have to plan another one in a couple of months because we've had such a
Yes.
response, because the information is so needed. And, I think what it is that we're able to do, because we are in most of the staffers of the council, we are clergy people, and so we're able to help with that interpretation. And so there are some things you mentioned when physicians come to this conference. Well, there is a conference for physicians at Duke Divinity School, and so that's where, if you are a physician and you want to help work with the church and work with mental wellness, that's where you go. But this is for the person you want things to be interpreted for you as it relates to mental health. And we have the ability to do that. And we are grateful that we have the ability to do that, because we are a nonprofit, but we receive funding that allows us to do that and to share this with the community.
Thank you so much, Dr. Simmons, for sharing with us today about the health and the faith and mental health summit that's coming in Greenville. Amen. And you provided a lot of information that our audience would definitely benefit from. We're appreciative of you coming and joining with us on today and giving us all the information. Thank you to our GPAC audience for watching this program today. And we're glad to have you. And GPAC Community Outreach, we have more episodes coming up. Until then, I'm Daryl Tedderton.
And I'm Tanisha Woods.
And we'll see you again soon. Thank you.